Hi, I'm Beau Humphreys, and this is the Personal Finance Show. It is May the 3rd. This is episode 6 of my special COVID-19 series where I'm talking to people from different parts of the world, some not so far from me, some very far from me. Australia was probably the farthest one so far. And the idea here is we want to find out what people are doing around the world, and things change from like province to province or state to state, and definitely country to country, because we all are allowed to make different decisions in terms of governments and just the way that society is and where you're located. If you're an island, there's probably a different policy than if you're a giant country with hundreds of millions of people, right? So let's find out what other people are doing and how this is affecting their finances and their life, and just it's a way to connect. I took a little break from podcasting after my 100th episode, and I spent some time with my son, and I got a full-time job as an insolvency counselor. So this has kind of brought me back. I was going to come back at some point, but I wasn't sure when. The pandemic seemed like a good time to welcome people back. So this week, I have a special guest from Guatemala, César Tánchez. Welcome, César.
Hey, how you doing? I'm fine. I'm doing okay. I'm healthy. My family is healthy, and we are glad to be here at your podcast, and hopefully we can talk a little bit and help out to give some idea of what's happening, like you said, it all around the world during this COVID-19.
Yeah, and you have a podcast of your own in Spanish, yes?
Yes, I have a podcast of my own. It's completely in Spanish. It's even tougher. The name of the podcast, that's Trascendencia Financiera con César Tánchez. That's my name. And yes, it's completely in Spanish. It's published once a week, 90 minutes every week.
So if you understand Spanish, or you're just wanting to practice and you're interested in personal finance, is probably a great way, because you'll probably be trying to figure out, okay, I think I know what he's talking about. I want to learn. Or if you are, if you just happen to be very bilingual and you're looking for more content in Spanish, it's a source. Thank you for being bilingual, so you could come on to my show and share that, right? And it's a not only is in different language, but personal finance is different around the world, and we're hoping we'll see if it gets accepted, and if we all get to go to FinCon in at the end of September this year. We may or may not be on a panel together talking about how people are different around the world, and how to write content or create podcasts that appeals to the whole world, as opposed to just your own country, right? Because we're not all the same. We have different ways of looking at things.
Yeah.
But for now, let's talk about your COVID experience. So, tell me about in terms of your personal life, how COVID-19 has affected it. Were you working? Do you have a regular day job, or a place that you go every day that you couldn't go, or were you already working from home?
Mm-hmm.
How has it affected your life so far?
All right. It's a good place to start. First of all, I have I'm an insurance broker in Guatemala. I have an agency, and I have 4 people that worked for me. And basically, when everything started all around the world, for us was just like everybody, like news. When it started getting worse, when there was Italy and Spain going to close their borders, many people dead and everything. We start to get a little bit concerned on that the COVID was not something to take so light about it. It was something that you had to take some care. Our president took immediately response on it and built some hospitals, temporary hospitals.
Really? Right away? Wow.
And actually went really fast, ordering all the people to stay at home. And we could not go out from 4 p.m. to 4 a.m. All the malls got closed. It wasn't optional. It was an order, an executive order.
And what were you allowed to do before 4 p.m.? Were you allowed to go to work, or was that shut down too?
One thing that made everything different, it was because all the public transportation got shut down. So if you had to work, it was kind of a gray area, because if you had to work, you have to provide all the transportation to your people. So not all the people could afford that. And basically, the executive order was that some type of business had to, like obviously public health, medicines, pharmacies.
Yeah, whatever the essential
needs had to work. They couldn't close down. And the order was everything that's not related to it had to close down. But it's hard for the economy, So, so people had to do some things, try to work out somehow, and probably deliver stuff to homes. That's probably a huge increment in business for everybody, to move around from people going to shop to taking your products and services to you. Yeah. So in my case specifically, I closed the office and then gave a laptop to my employees so they could work out from home. And because it's an insurance business, it has not going down, because you don't want to be left now from your health insurance and your life insurance. Right now, it's not like but normally in most crises, at least here in Guatemala or Latin countries, the first thing you cut down is insurance, because you see it like the first thing you can skip out. But why is that? Like, wouldn't people still need their insurance? Yeah, of course they need it. But we are not so like the insurance has never been so important or so high in your priority list. So if you had some problems with your economy, one of the first things that goes out is insurance. So normally any crisis, it goes directly to that industry, or at least for my industry. Yeah. But this one hasn't. People have kept their insurance. They know that's important right now, and they like life insurance, and health. Yeah, and health. And so in Guatemala, you have is it it's not a public healthcare system, it's private? We have public healthcare system, but it's not good. So you will see that options. Yeah, so you have to go private. If you're like you have a job, just like you have a job, you have like you're a media manager or an assistant, you need a health insurance, because the other you have it, but it's not good. So so it's there for people who are low income, who can afford private health insurance. Yeah. They can go to the public, but it's not great, and there's not a lot of funding or anything too. Like a small country, you have like every other country some issues with government, but always health is a big issue, because you have more and more people than you can actually attend. And in Guatemala, our medium income is $4,000 a year. So, so you can figure out that even though there are many people who have good amount of resources, and you come to the main city in Guatemala, is a 4 million people city, and you will see good business, good things to do, and whatever. But the most of the people are outside the city, and probably with very, very low income. So no matter how much hospitals or how much budget they have, it's still pretty low from what's needed. And so, is that 4,000 US? 4,000 US dollars, yes. So that's our median cap per person in Guatemala. About 6,000 Canadian or so. But still, let's just say it was $5,000 in my in terms of their cost of living. Then, if they're living outside of the city, they can survive a very basic life on that. Yeah, we have Guatemala has a very low cost of living. Remember, actually, we can live with pretty with not too much money, But that doesn't mean that most of the people can even have that. Just to put it just on a small example, the median income in the U.S. is $60,000 a year. So it's a huge difference. I just happened to see a report from the U.S. And the U.S., someone who is considered poor is if it has an income of $25,000 a year. So make the math.
Level.
So if you have, you have a job, you have a little more than you need. Health insurance is something that probably in the mind of the people here in Guatemala is very much, it's way high to the importance than life insurance.
Wow. Okay. Yeah, that makes a lot of sense. So you sell health
so we have this brokerage
life insurance and what else?
And
other insurance, auto insurance?
Yeah, auto insurance. That's a curious one because auto insurance has gone really low. The people have left the auto insurance. First of all, because they cannot move that much. They know that they can have it any time later, and it wouldn't affect their health or affect their people if they die or something. So
that's right.
That's one that they have left. So here in Guatemala, I know that in the U.S. you have to have like different license. At least in Guatemala, we have all the license to sell every type of insurance in Guatemala. And the rest of the time, probably, I don't know, 50% almost now, I dedicate to personal finance. I have a radio show. That's posted on the podcast, but basically it's a radio. It's a radio format.
So you've been doing it on local radio in Guatemala for how many years now?
It's going to be 11 on July.
So 11 years, and then at a certain point you transferred. You said you started transferring it to podcast form using iBooks like a couple of years ago, or
a couple of years ago.
And then just recently, you transitioned over to Spotify and Apple Podcasts and things like that.
That's correct.
And so we can find you, right? You said the title earlier. Trascendencia.
That's a really tough one.
Financiera. Trascendencia Financiera.
You're very close, yeah.
Did I get it?
Yeah, good enough.
Good enough. I'll put a link for sure in the show notes. But,
okay.
So you are able to make enough money for yourself by working like just sort of 50% of your available time.
That's correct.
On the insurance. And then do you actually earn income from the radio show as well?
No. That's the curious thing. The radio show is a radio show that's sponsored by or it's maintained by a church. And because it's maintained from it, they have a format, a really strange format, but they have been successful with it. They have been on air probably almost 12 years now that they don't have sponsors. They just produce content. So everybody that are related to them, including myself, we donate our time. So
nice.
So there can be some good content to the people. I talk about personal finance, but there's someone who's talking about, entrepreneurship. Another one talking about what happens on local things in Guatemala. Well, they have different formats.
Yeah.
And we decided a couple years ago that I can both the radio and myself can use the content however we like. So I decided to use all that content that has been produced to go for a podcast.
And so you were able to do that, and then we met I guess 2 years ago.
Yeah, at Orlando. Yes.
Yeah. At FinCon in Orlando.
That's
correct.
And
you were at DC last year too?
Yes.
Yeah, but we just didn't bump into each other.
We didn't bump in. Yeah, that's correct.
No, I don't know. There's a lot of people, a couple of thousand people, right? But I figured that I would see just by accident, even, right? Bump into each other, but
it was
happen.
Curious. Yep.
But no, we had a good conversation in Orlando. I remember. That's why I called on you. And it's nice to be able to do this as a passion when it's not something that like we work our day jobs. Like I'm an insolvency counselor, you're an insurance broker, right? We work in money, right? We deal with money and personal finance all day, but it's not, this is something that we can use to connect people and really just continue to spread the word.
That's correct.
It's, we can work in finance, but it's, they're very specific things, right? Like we do specific things in our jobs, and it doesn't mean that we can help everybody. But enables us to help people, by donating our time, as you said. As I do that too. The podcast costs money in terms of being able to, right? It costs time. It's time that you could be spending.
Yes, a lot of things. Yeah.
So you're able to work from home then. Your income has not been affected that much, or it has been?
It has been affected, of course. We haven't sold anything new. We have only maintained all our customers. And all the auto insurance, like you asked me, they have gone, like many of them. So that's been the most difficult part, that we have not sell anything new. And some clients have gone, but my main income has still coming in. And the other thing is that also when you are confined, you tend to have some savings, not spending that much because you are not commuting. You basically we had in Guatemala some things that most of the people that have the properties where you rent, they have given you some discounts. In my office, they gave me a 25% discount.
Okay,
for
good.
the
So
rent.
you have some commercial rent relief.
Yes.
So is that the government has implemented that?
No, they have not interfered in it.
Oh, okay.
There has been something. Well, I think that most people know that if you don't help, you are losing anyhow, because they probably won't pay you because they don't have the income to pay you, so they rather step out and help you out in somehow, so everybody can help each other with the rent or even.
I mean, I agree with that. I like that concept, but unfortunately, without government interference, that wouldn't happen in Canada and the U.S. Some landlords, depending. They wouldn't care, right? They're just like, you got to pay me my rent. But what they're doing is basically bankrupting the people anyway, and so they're losing on the long run. And so they should get that. Unfortunately, some people have to learn the lesson the hard way instead of just being nice. But there are some nice stories coming out of North America, right? With landlords just forgiving rent for a month or two, right? Just like without people asking. I guess the main line here is, if you can pay your rent, please do it.
Of course.
But if you can't, communicate with your landlord. And but you didn't even have to communicate. Did they? No. They just said you got a discount.
Yes, and as
nice.
I told you, because I haven't been totally affected, I have been partially affected.
Yes,
I'm paying my rent, and I take gratefully the discount they can give me, because nice. That will help me out the absence of some income that I'm not generating. So the same thing, because I have some property that I can I do rent. I do the same.
You're a
to
landlord
the
as
other
well.
Ones.
Yeah. So you pay it forward, pass it on.
Yeah,
to the next person.
That's correct. That's correct.
Yeah, because
I think that's the way you have to.
Do you have residential tenants then?
Just one, a residential one, So,
and are they still working?
They have been having let's say as a country, we're having I think almost every country having a hard time in the economic economic area, because they're not working. All the people are kind of concerned with money. If they have some money, they don't want to spend it so freely. And if they want to spend it, they're afraid to spend it. Let's say just a haircut. That's just to say something basic. Probably you need it. Probably you have the money. Probably you want to do it, but you're afraid that you can get the disease somehow for some failure on hygiene aspects or whatever. So,
can you still get a haircut? Are they still open? Do you know?
They're not open as a place where you can go, but obviously the people are are improving, are innovating, and they are like offering their services at home.
Okay.
And
Interesting.
the good thing is that the thing that I have seen, at least, or the ones that have been doing some business, they don't have the focus on what they're doing. They are having the focus on how all the norms of hygiene they are making. I do not enter your house. I will cut your hair outside your house. I will take my shoes. I will clean up everything in front of you. Both of us have to use masks. So it's more about all the hygiene protocols than the service per se. So it's
would
changing.
You say is that representative of the culture? Is everyone is just trying to do whatever they can to help people and to adapt? Is it? Are you?
Yes.
Would you find like your experience, especially in the big city? Are you? What city are you in?
I'm in the main city, Guatemala City.
Like
it's Guatemala
City,
country, Guatemala City. Mm-hmm.
Guatemala City, yeah. So
can I say something about it?
Absolutely, please.
Yes, because many people say, where is Guatemala? So I have a kind of experience telling where is Guatemala. Okay, it's Canada, U.S., Mexico, and then Guatemala. That's an easy way.
Right there, right underneath, right? Okay. And like you said, is it mostly the city where the population is? Like you said 4 million? What's
in the main
total?
City. But the whole is only 17 million.
17 million.
Well,
okay, so
Canada is not so big for
size. We're just
but,
maybe 10, 15 million. But we're so much bigger in space.
Yeah,
like we could fit 1 million Guatemalas into.
And you wouldn't even notice that they are around.
Yeah, but it's funny. It's the population density then much higher, and I've been to. I haven't been to Mexico. I've been to Costa Rica.
Yes, a very nice place.
I've been to Peru. So I've been to South America.
I know both countries, and I really, Guatemala is more likely like Peru somehow.
Yeah,
because we have some Mayan people on the outside of the city.
Right? Yeah,
the physiological type are more likely. When I went to Peru, it seemed like being a huge Guatemala. Just to put an example, Guatemala is 100,000 square kilometers, but in Peru there's 1.2 million.
Yes,
it's 12 times us.
the Andes and also the Peruvian Amazon too, right? And I've spent some time there.
I spent only on the south. I went from Lima to Huacachina, the desert of Huacachina. Cusco.
So you didn't go up into the mountain. Oh, you went to Cusco.
Yeah.
So that's where I stayed for. I was in Cusco for about 30 days.
30 days.
I took 10 days, and I went to the Peruvian Amazon on a bus.
Wow, I know what that means. Oh my God! Did you survive that one?
I did. A lot of people wish they didn't have to take the bus back, but there was only one way to get back, and that was the same bus that took us there. It was a good experience for me, a good time in my life to have.
You won't
some
forget
perspective.
it.
Don't forget having to look out the window and seeing the mountain cliff. Absolutely, you know what that means. Do you have similar topography? Do you have mountains and
not like
volcanoes?
Peru? Yeah,
not
like Peru, but
not Andes, but
similar. We're surrounded by volcanoes. Probably one of the beautiful sites in Guatemala is to look up for the volcanoes. Especially in November, where have beautiful sunsets and sunrises, and with the volcanoes on our back, we can see volcanoes almost any place in the city or almost any place in Guatemala. Actually, we have 24 volcanoes, so it's a really nice scene. Yeah.
Yeah, I'm of course I just pulled up a map because I feel like I need to place myself, but you're not that far from Costa Rica, so it looks like it might be like on the same sort of curving on the fault line that created the volcanoes, right? I don't know.
Costa Rica doesn't have that much volcanoes.
Going like that. maybe not as many as Guatemala, but they have a lot. When you fly into San Jose, there's like 4 or 5 volcanoes just to the right. We went to Irazu and Poas.
Poas.
We tried to go to Poas to see because there's an awesome crater there.
Yeah, but you can never see
cloudy.
it. Yeah, it's always cloudy.
We only had one day, so yeah. So you've done a lot of travel, then.
I like to travel. Yeah.
Is it something like? Can you? I mean, I know it looks close, but like, would you be able to travel by land or?
The roads are the main issue. They're not so good roads,
I see.
So it could take a lot of time. So
there's no like Central American Highway, like a main one that you can.
They have been talking about it many times, but they have actually never done it. So, but it certainly will be nice because in distance we are really close, but the roads are really bad. There's not direct one.
Yeah, even within Costa Rica when we were there, just to get from one to the next, it looked so close. But we would have, like bumpy roads that you couldn't go, very fast on, right? So
it's the same in Guatemala.
The infrastructure is similar. Yeah. I mean, yeah. So the Central America, where would you cut off Central America?
In Costa Rica,
Panama.
No, I will cut in Costa Rica.
Panama is South America.
Panama. If you ask them, they will tell you that they are not Central America.
Okay.
And if you ask them if they are South America, they will tell you that they are not also South America. And
it's right in the middle of both,
it's
right?
in the middle of both, yes.
Yeah, okay.
And
interesting.
Panama is very different from Central America because, if you go to Panama City, I don't know if you have been there, but
I've not, no.
It's a small Miami, so you have skyscrapers, you have...
Sure.
It's very different. It's very different from Central America. So I agree that they feel like they are not from Central America. But I would cut it. I would cut it on Costa Rica.
Yeah. Okay. Good to know. Because So then I've been to Central America and to South America. So you gotta get
I'm
that.
Sorry, I don't know why it's ringing this one.
You good?
It is not even the phone. It's I live in a condominium and
it was like someone is
coming in or whatever. I couldn't somehow prevent that.
This is I like these moments in podcasts. It's like when somebody's dog barks. It's like.
I'm sorry, but
no, don't worry about it. Remember, I'm not going to edit any of this, so it's all just as reality, right?
All right.
So. So we got the lowdown on Guatemala, and they really seem to take care of the people as quickly as possible, which is nice. I mean, like you said, you can't do a lot about people who are living in poverty, but hopefully they're still able to live, and not have a lot of costs. I guess that's outside of the city, people who don't have jobs. But to build hospitals, do you know how the virus is affecting people? Say outside of the city. Have you heard anything?
Yes,
about that?
We have been fortunate enough that the virus is not from our country; has been imported from other places. So, basically, all the cases that has been detected had been from the city. So everything has been mostly contained on the city. We have only 2 community cases that were fastly detected, and they are kind of under control.
Where they came from, and then
they have shut down the small town and everyone they had interacted with, so they're under control. The other ones have been from the city. At least for last night we have 688 cases. That's our total, and 17 deaths. So
17 out of 244,000 in the world. That so
I know.
You're good, and
we're good.
Obviously the lockdown took care of any.
Yes.
Yeah, right. Anything that might have happened. It's always like if you lock down early, like New Zealand did, right? They've eradicated their cases. Apparently, no more COVID. That's what they say, anyway. Being an island, it's a lot easier to contain, right?
And a far island.
Yeah, exactly. Far away.
It's not
so
Japan.
If you do everything, if you do everything right, it seems like that wasn't a big deal, right?
Yeah.
Right, but you don't know how it could have been, right?
No,
that's,
you just
that's
can
the
look
downside of
yeah,
doing
you
it.
just can look back and say that I did a good or a bad decision, but you have no reference to take a decision. So the good thing in Guatemala is that we have just had how can I say it? The beginning of the mandate of our new president. So the actual president began the 14th of January. And the thing about our president is that he's a doctor. He's a doctor.
Oh, wow. So of course it all happened right away.
He knew how to react quickly to the sanitary position in Guatemala. And has been a little bit, diligent with the economic side. But when he knew what's happening with his experience as a doctor, well, he reacted, I think, and most people in Guatemala think that he reacted really, really good because it was in an area that he had at least some experience as all the studies that he had.
Well, and there's evidence, obviously, 17 deaths. And I don't know the demographic, but typically people who are dying, especially if it's such a low number, it's very likely people who are compromised already. In terms of their immune system, perhaps because of age or other
That's
reasons,
correct.
right?
Mm-hmm.
That's the downside to this, right? It's people are like, oh, I'm healthy, or if I'm healthy, if I get it, fine, I'll recover.
Mm-hmm.
But then you can carry it to somebody else, and it's carrying it to those people,
that's the
right?
problem, yeah.
That is the downside, right? In terms of people who have lost their jobs, what is the government able to do for them financially? You have employment insurance or unemployment insurance in Guatemala?
No, we don't have unemployment insurance.
Okay.
They are actually right now starting to have some kind of employment insurance. And they are helping out with the poorest people, giving them, it will be around $140 more or less for 3 months. I know that doesn't seem a lot, but at least for the poorest people, it will give them some air to pass through. So that's probably one of the helps that the government have been trying to give to the people. They are also giving them some food. They are having some bags of food. They are around, I don't know, the last time I heard the government was 300,000. Let's say 300,000 is not such a big number, but with 360,000 in Guatemala, they're probably in the poorest side of the country. You will find 5, 6, 7 people in one family. So they will eat all of them with one of these baskets. So at least will help out. And there's somehow they are trying to help. They are also giving some the banking industry. They are giving them some incentives so they can lend money with.
So increase
lending. The companies can have some money to pull on to be able to break through this economic side.
Is micro lending a big thing in Guatemala for people outside the city, like small loans for there's a definite term for the kind of bank, a community bank where everybody sort of puts money together and then lends to one person so they can buy something for their farm or that they need. Does that happen in Guatemala?
It's happening. It's like I don't know how to say it in English. Like cooperativa. It will be
cooperativa. Yeah, cooperative. Yeah,
cooperative.
Absolutely.
Yeah, that's probably the closest to it. And there's a bank that probably is one of the biggest banks in Guatemala that has been their target, giving microloans to the people that are outside the city. And they are doing a great job because, they are lending people let's just give you just to give you an example. They will have ATMs that, because many of these people cannot read, but at least they will put it in somehow the ATMs that they can understand it, so they can have money at 4 a.m. because that's the time where they're buying all the food and everything they save.
Yeah, okay.
And when when the bank opens at 8 a.m., they have all the money that they have sold and give it with interest. So it's like 4 hours, 4 hours deal. So they have been doing a great job. Still, of course, there's a lot of more needed that's available. But yeah, we have something about it. Yeah.
Interesting. It's interesting to see what they're doing, because I mean we have employment insurance, and for those who are entrepreneurs and don't qualify for employment insurance in Canada, they're giving everyone, if you made $5,000 last year, you qualify for emergency benefit of $2,000 a month from the government. So that's what people are getting here, but still a lot of people don't qualify if they didn't work. There's a lot of it seems to be new benefits every week, and like you said, the government is working on different things as well in Guatemala, like
they're trying
based on what's happening, like because more and more people are out of work, or
just to put an example, and that one really hurt because we have a hotel here that's a Westin. There's nothing new about it, but the first hotel, the name was Camino Real. It was a local hotel, probably the nicest I remember a lot of years ago, and it had been part of the chain of Westin lately. But a couple of days ago, they said we have to shut down. And we have to shut down. And for us, it's like it's not just one hotel. It was probably if you wanted to go to, or you were invited to a fancy place to have a party or whatever, it was that hotel.
Yeah.
So they're closing their doors. It's like, whoa. It's getting
very
tougher.
Symbolic of what's happening when something like that, something iconic will close down.
Yes.
I can imagine if we have a few places like that in Toronto. If they had to close down, it would mean there's a Westin right downtown Toronto with a Westin Harbour Castle. If they were like, oh, we have to shut down, that would mean something to people. Absolutely.
Yes, because it's iconic.
Yeah, exactly. It's such a staple. We also have the Fairmont, the Royal York Hotel, downtown Toronto. That would be, it's the center of the city, right beside Union Station, right? Things like that. When those things are starting to take a hit, it's tough, right? You and I are very privileged to be in industries that are not, like you do face clients, but you can still do your business remotely if you need to, right? Hopefully people will start wanting insurance again in the future. Do you imagine that you're going to be doing business in a different way going forward when things just start to sort of? I don't like to use the term reopen, but when we try, because that means like things are opening again, which it's like let's reintegrate. When we start our new normal. How does that look for you?
Well, I have been like doing, like I told you, two things. Will be the insurance for by one way, and the other one has been personal finance. And the curious thing about it is that personal finance, I think it changed for good. Because I don't know how it's in Canada, and that will be a nice thing to talk about if we are able to talk about it in FinCon.
Absolutely, yeah. I'm looking forward to that if we can.
Because here, at least in Guatemala, you will say, okay, personal finance is important, and everybody will say, yeah, right. It's
sure. Okay, yeah.
You should give a speech of 30 minutes, and that will be okay.
Okay, yeah, I understand.
And right now you're looking up that even companies, not just personal finance, you have to have cash at least 30 days, at least, probably more. I studied business administration in Guatemala for 3 years. And I remember when they taught me over and over and over, if you have money on your check account, you are a bad manager. You're a bad manager.
Really?
Yeah, because
they thought you should be investing it. Or
sure,
spending
you
it?
should be investing. You should be buying more something to get more productive or whatever.
So they taught you in school that it was bad to have a cash flow buffer.
Yes.
Interesting.
And right now you're seeing that it's not like that even for companies. We have talked about several and different times to tell people that you have to have a like emergency fund of $1,000 or 3 or to 6 months of cash, and they will say, yeah, right, yeah, it's good to have, yes, but right now.
It's the difference between surviving and not,
and this won't be the last one.
Well, it seems more important for your country because you don't have employment insurance.
That's correct.
But what did they say to you? Did they brush it off and say, I'm going to be fine, nothing's going to happen to me? Is that what they think?
Before COVID, yes. Because they think everything is going to be all right. You always will have job, and you can always have some type of income. But right now, everything changed. So people are starting to know that personal finance is not something good to have. It's a must-have. And by that way, I have been reached from different sectors, companies, banks, and that they're telling me to talk about them and probably do some projects, some paid projects. So
absolutely,
it's open. And something else, when you talk, at least in Latin America, we are very close. We're extremely close. We say hi with a kiss. We almost give hugs almost everyone. Yeah. So if you want a meeting, you have to make a personal meeting. You have to get coffee. You have to talk about it and everything. So right now, when let's say before, when you wanted to do something digital, I have a book. I have written a book, and you will only sell it if you can touch it. But digital, it's
it's harder to sell digital.
Right now, everything is changing.
Right now, it's different.
Everything is changing. So people are now going to meetings online. They are hearing podcasts. Right? In my country, podcast was like, it's okay. You have a podcast,
now,
great.
Everything. So you've been working on this for a bit, and it's an opportunity for you to.
That
was pretty good. We made it 40 minutes without it cutting out. I was impressed by that. But
that's good.
What we were saying before the internet cut out. We're in different countries. I'm not surprised. Mm-hmm. But we're back, and what you're saying was you have a lot more opportunity now to help more people. And this is good because this is a bad situation for everybody. Of course, nobody's enjoying this. We got to find the opportunities to help ourselves, but also help other people. Of course, and the silver lining in all of this, or things are changing, and also everyone kind of has to adapt a little bit. It sucks a little bit, but we have to adapt. If you were doing something, well, we're not going to be shaking hands in North America, and you might not be kissing cheeks as much, right? That's going forward, and we can mourn those things too. But these are just examples of the things that are going to be changing. So the way that we do business is changing a little bit, and we can find connection in other ways. And just like this, we're connecting. We haven't seen each other in a couple of years, but it's like I feel like we're meeting in person right now, you and I.
That's correct. Yeah.
Because the alternative, even if we lived next door, we couldn't see each other, but we don't. We live, thousands of miles away.
Yeah, that's right? Correct.
So it's really good to see personal finance being taken a little more seriously. Yes. In Guatemala, and at the same time, we're trying to balance in North America, trying not to shame people for not having an emergency fund, while at the same time saying, hey, okay, so you didn't have one, fine. Now what's your plan for when everything starts up again, right? Yeah, and so we want to focus on going forward and not saying, well, you should have done this or you should have done that. No, because that falls on deaf ears and like, well, what can you do for me now? Yeah. And then what can we do for the future? And so that's where we all come in. That's kind of our job going forward, is to help, whether it be a pandemic or it doesn't have to be a pandemic. It can be your personal pandemic of just getting sick and losing your job.
That's correct.
It happens to people all the time, and until it happens to you, you don't know, what you needed to do.
That's correct.
You know, I had an insolvency in the past. That's why I'm an insolvency counselor now, right? I had a terrible time in my 20s, and I was in a lot of debt, and I got out of that. That was my personal pandemic, so that when this one came around, I was ready. And that, you know, it's just something that you have to have in your head, right? It's not easy. It sounds so simple, right? Like just save money, right? It's easy to say, right?
Yeah.
But there's a reason why we have so many people in our community talking about it in different ways. It's because it's not easy, and it's different for everyone, and people respond to different voices, right?
That's correct.
In your case specifically, in different languages too, right? So like that's why we all just need to keep talking about it in whatever ways. And yeah. It was really great for you to join me today. I'm really happy we got to have this done. And only one disconnect, which I can just sort of paste together.
That's correct.
Really
only
easy.
one.
Because the only way I can do podcasting now is to do as little editing as possible and do it all on a Sunday morning.
I know.
Because you have kids as well, right?
I have two beautiful daughters, but I know what it is.
Exactly. You got to find time, but not too much time, because then it takes away from family time and also time to make money and you know, other things that are important in your life. So thanks so much for joining me. Any final words from you?
Yeah, I had a great time. It was good to see you. I know that you are hearing this, but we happen to be able to get to see each other by this platform.
Through this video platform here.
Yeah, video platform help us out to had a good time. And I just want to finish with something. Okay, we have all, and I mean as personal finance educators or even any people, you have to think in two ways. What are you doing during the confinement? And what are you going to do after the confinement? I know that's a basic knowledge, but yeah, what are you going to do to survive right now? That's the I think basically in my country, that's what have changed the most. Like I told you, I have a radio show, and you normally will talk about getting out of debt, how to buy insurance, and many stuff. But when this thing came through, we have to change. We have to learn. We have to figure out how to help people to have some income when they have no job. And I don't think no one had, or at least I haven't even read one book talking about it, because everything was brand new. So we are, have to be reinvent ourselves and be able to pass through this time, because it's going to pass. But one thing is how we're going to get through this, and how can we take advantage of this. The problems have changed, the solutions have changed, and so our message has to change. And I think that if anyone can apply that to their everyday business, they can be more productive, more resilient, and they can take some good advantage in a good way to generate more, to be more diligent, but also to be more effective and generate more income. I strongly believe that this now is hard, but when it passes through, we are going to be much better than when we enter this phase of the humanity.
Well, that's a fantastic message. No better way to end it. Thank you so much, Cesar. And I really hope that we get to see each other in person again. But otherwise, have a great rest of your weekend, and stay safe, okay?
You too. Thank you. I really enjoy it.